Fluoride's toxic dose 5 to 10 milligrams per kilogram. Usual fluoride in usual water fluoridation 1.0 parts per milliliter, 1.0 ppm. 1 ppm for average fluoride in water. Fluoride supplementation is effective in anyone but most beneficial to children. What age should fluoride supplements be started? At 6 months. Next, at what age does fluorosis of teeth, anterior teeth, permanent teeth occur? Answer: 4 to 6 months. At what age does fluorosis of teeth, of anterior permanent teeth occur? 4 to 6 months. Next, fluoride supplementation is effective in everyone but more beneficial to children. How many minutes do you place neural sodium fluoride tray on teeth? 4 minutes. What concentration of acidulated fluoride is used in the dental office? 1.23. 1.23% is a concentration of acidulated fluoride in the dental office. 1.23. How do you determine the severity of fluorosis? Higher the fluoride level, the greater degree of enamel change. So look at the two worst teeth. What does fluoride do? Fluorapatite, which is acid resistant. Fluoride does all of the following except direct action on plaque. Yeah, fluoride does not have action on plaque, it just makes more resistant or stronger enamel. Fluoride makes enamel more resistant to future caries. Where does fluoride localize the outer enamel? Fluoride accumulation. Where you will find fluoride more accumulated on? Away from the dentino enamel junction. On the surface of the tooth. Fluoride helps prevent caries in all ways, except fluoride does not have an effect on the pH of the oral cavity. Fluorapatite actually has a lower pH of 4.5, so it doesn't really, fluoride does not change the pH in the oral cavity, but it will make the hydroxyapatite change it into fluorapatite, replacing hydroxy. So fluorapatite is more makes uh, fluoride makes fluorapatite, which is more resistant to acid, decreases the solubility of enamel excreted by kidneys, and helps remineralize. It does not increase the strength of collagen. Fluoride breaks down collagen. And also, fluoride is bactericidal. So Dean's fluorosis index. So Dean's index, the subject should be examined in the upright position with the examiners facing the subject with his or her back to the light. Natural light to be used. If fluorosis is present, decide on the two most severely affected teeth. Dean's index is scored on the condition of these two teeth. If the two teeth are not equally affected, score on the least affected. When scoring, start at the higher end of the index, i.e. severe, and eliminate each score until you arrive to the condition present. If any doubt, the lower score should be given. So in the classification there's different criteria. The first one is normal and code. The criteria for this classification, the normal classification, is code 0. The criteria is the enamel represents the usual translucent semi-bitriform type of structure. The surface is smooth, glossy, and usually of pale creamy white color. Next, questionable. Code 1. Criteria. The enamel discloses slight aberrations from the translucency of normal enamel, ranging from a few white flecks to occasional white spots. This classification is utilized in those instances where a definite diagnosis is not warranted and a classification of normal is not justified. Very mild is 10 to 25% of the surface, mild is 25 to 50%, and moderate is 100% of the surface. All the surface enamel surfaces of teeth are affected, and surfaces subject to attrition show wear. Brown stain is frequently a disfiguring feature. And the last one is severe, which is 100% of the surface, but the enamel surfaces are affected and hypoplasia is so marked that the general form of the tooth may be affected. So, fluorapatite does not increase the strength of collagen. Next question. Fluorapatite Fluoride's toxic dose is 5 to 10 milligrams per kilogram. So the usual water fluoridation is 1 parts per ppm, 1.0 parts ppm. Next, what is the EPA highest concentration of natural fluoride in drinking water? 4 ppm. 4 ppm is the highest concentration of natural fluoride in drinking water. Next, maximum allowed fluoride in the water by EPA, Environmental Protection Services, I guess. Maximum allowed fluoride in the water by EPA. Oh, Environmental Protection Agency is EPA. So, what is EPA's highest concentration of natural fluoride in drinking water? 4 ppm. What is the EPA's highest concentration of natural fluoride in drinking water? 4 ppm. It's just also the amount, the percentage of 4 minutes that you should have it on the patient's mouth when you're using a fluoride tray. And the dental office will use a concentration of 1.23. Community fluoride is in unprivileged areas is very low. Or 0.2%. How do they administer fluoride in schools? 0.2% fluoride rinse once a week. 0.2% fluoride rinse once a week. What happens when a kid with primary teeth ingests fluoride? It affects their permanent teeth. Next question. There's a fluoride table, which there's a 5-year-old with 0.75 ppm intake. How much you need to supplement fluoride? 0 ppm. Remember that fluoride table, 5-year-old with 0.75 ppm intake. Fluoridation supplement 0. A 4-year-old lives in a community with 0.28 ppm systemic fluoride supplement. To prescribe fluoride rinse because he's 4 years old and he lives in a community with 0.28 ppm. Remember that 1 ppm is the average fluoride in water. Point 0.7. Yeah, 0.7. So if a 4-year-old lives in a community with 0.28%, you will supplement only 50 milligrams per day. So that's why in a patient that is 5 years old and his ppm intake of fluoride is 0.75, you don't need supplementation because the ideal is 0.7. A 2-year-old takes 20 milligrams of fluoride pill, nausea, renal failure, cardiac arrest. The answer is nausea. He will have nausea. He will not have renal failure nor cardiac arrest. He will have nausea. Early symptoms of fluoride poisoning include gastrointestinal pain, nausea, vomiting, and headaches. The minimum dose that can produce these symptoms is estimated to be 0.1 to 0.3 milligrams per kilogram of fluoride. i.e. 0.1 to 0.3 milligrams of fluoride for every kilogram of body weight. So if you weigh 100 kilograms, the amount that could cause you this kind of symptoms would be 0.1 to 0.3 milligrams for every kilogram of weight. So you have a 7-year-old patient who has no fluoride in drinking water. What do you give them systemically? You give them 5 milligrams, you give them 1 milligram, and you want to give them 0.25 milligrams. The answer, according to his age, is 1 milligram. Why? Because you go from 3 to 3. From 6 months to 3 years, they will have need only 0.25. So think about a little kid only gets 25 cents. Then from 3 to 6 years, you count 3, 3, 3. From 6 months to 3 years, and then from 3 years to 6 years, and then from 7 years all the way to 16. So it's every 3, 3, 3. Okay, so first one gets 25, the second one gets 0.50, and the last one, the 7 years to 16 years old, gets 1 ppm or 1 milligram. So the appropriate amount of fluoride in the community water, its optimal range of fluoride in water lies between 0.7 to 1.2 parts per milliliter. 0.7 to 1.2 parts per milliliter. 4.5-year-old child with 0.75 parts per milliliter fluoride in their water requires how much fluoride supplement? Again, a 4.5, 4.5-year-old child is getting 0.75 parts per milliliter fluoride in their water requirement. How much fluoride supplement does it need? No, it does not need more supplements. He has plenty. 0.75 parts per milliliter on a 4.5-year-old child. That's has no need of anymore. Next, supplementation for 10-year-old with no other fluoride source. 1 milligram per day. Question: a 2.5-year-old with 0.4 part per milligram fluoride in water. Normally, we would say it's not necessary, but there's not that option. So, a 2.5-year-old. Remember that after 6 months, all the way to 3 years, you do 0.25 milligrams of supplement, and he's getting 0.4. ppm. So yeah, 0.25 milligrams. So you can come close to 0.75 or 0.7. Next, the drinking water supply of a community has a natural fluoride level of 0.6. The fluoride level is raised by 0.4. 2DK is expected to decrease by what percentage after 7 years? The answer is 40%. 40%. So 0.4 over 1, because 0.4 plus 0.6 equals 1. So 0.4 over 1 times 100 is 40%. Again, if they raised, it was 0.6 parts per ppm, and they raised it to 4 points to 1. So after 4 years, after 7 years, you do 0.4 of what was raised entre 1%, 40%. So a 3-year-old patient lives in an area with 0.4 parts per milliliter fluoride. How much do you supplement? 0.25 milligrams. Again, he's 3 years old. He lives in an area of 0.4 fluoride. You remember? Hold on. So 3-year-old patient lives in an area with 0.4 ppm fluoride. How much do you supplement? Next, 7-year-old child living in an area of 0.2 ppm fluoride. Water supplement. He should have okay, I'm gonna skip this part because I don't get the supplementation very well. Let's see. Let's look for fluoride supplementation. Okay, so fluoride supplementation. If it's less than 0.3 at 6 months to 1 year. Okay. So less in an area where there's less than 0.3. In an area where the supplementation on ppms is less than 0.3 and the age is every 333, okay? So 6 months to 3 years, 3 years to 6 years, and 6 years to 16. So in an area where there is less than 0.3 of ppm, you will do a supplementation of 25, 25, 25. So 6 months to 3 years will be 0.25 milligrams. 3 years to 6 years will be 0.50, and more than 6 years to 16 will be 1 milligram. Okay, if the concentration of fluoride ppm is from 0.3 to 0.6, a 6-month-old to 3 years don't need any supplementation. Okay, a 3 to 6 year old don't will need a 0.25, so it just goes up. The 25-25 law just goes up. So 0.3, 0.3, 0.3. So 0.3, less than 0.3, less than 0.3, 3 to 6, and 6 ahead. So 6 months to 3 years, 3 years to 6 years, and 6 years to 16. So that's the table. It's kind of not very hard to see. 6 months to 3 years, 3 years to 6 years, 6 to 16 goes with 0.25 if it's less than 0.3, 0.25, 0.50, and 1. If it's 3 to 6, no supplementation, 25, 50, 0.50, and if it's more than 0.6, there's no need of supplementation on any age. So 333. So if the patient gets 0.3 to 0.6 milligrams from water, then have supplement from 3 to 16 years. Have to supplement. A 7-year-old patient has no fluoride in water. What do you give them systemically? A 7-year-old patient has no fluoride in water. What do you give them systemically? You give them 1 milligram because he's 7. He needs to be right now in the 3 to 6, no, in the 6 to 16 group, which is more, it's 1 milligram. Yeah. Next question. So, if you have a 10-year-old that has no supplementation, that has no fluoride, what do? 1 milligram a day, because remember he's in the group of 6 to 16. Group of 6 to 16. Now, just to review, if this 10-year-old that is in a group of 6 to 16 had a supplementation, in his water he had point 0.6 parts per 0.6, then you I got confused anyway. Okay, next question. 2.5-year-old with 0.4 ppm. He needs to have 0.75. So 0.25 milligrams as a supplement. Now, the drinking water supply of a community has a neutral fluoride level of 6 ppm. The fluoride level raised by 0.4 ppm. So 0.6 plus 0.4, it's 1. 2 decades expected to decrease by what percentage after 7 years? So 0.4 divided by 1, because 0.4 plus 0.6 equals 1. So 0.4 divided by 1 times 140%. Next question. A 3-year-old patient lives in an area with 0.4 ppm fluoride. How much do you supplement? Again, a 3-year-old patient lives in an area with 0.4 ppm. How much do you supplement? Remember that this is also the 3 laws. If it's under 3 ppm, if it's 3 to 6, and if it's over 6, I'm sorry, And so 3-year-old patient already falls in the 3 to 6 category, in which it already will be needing supplementation if his PPA is PPA is 3 to 6 ppm. Yes. So yeah, 0.25. Next question. A 7-year-old child living in area with 0.2 parts per milliliter fluoridated water supply. Supplement 1 milligram. He already in the group of 6 to 16, in which they'll need more than 6, all the way to 1 milligram, 1.7. So 1 milligram is good. So you'll have 1.2. What type of fluoride in water? What type of fluoride in water? Include fluorosilicic acid, which is hydrofluorosilicate. Hydrofluorosilicate is most commonly used. Sodium fluorosilicate and sodium fluoride. Okay. So acidulated phosphate fluoride solutions must be stored in containers that are made of polyethylene. The question will have different options in which they will include different kinds of glass, like brown glass, clear glass, and etched glass. And also the option that any of the containers mentioned are suitable, but acidulated phosphate fluoride gets more acid in glass, so the best container, the more suitable container, would be polyethylene because it's plastic. So acidulated phosphate fluoride should not be stored in plastic, in glass, only plastic. Next question. What mouthwash is good for children with caries? Sodium fluoride. What toothpaste should not be used in a patient with multiple porcelain crowns? What toothpaste should not be used in a patient with multiple porcelain crowns? Some answers say, some people say stannous fluoride, and some people say acidulated. What would research?